Hello. Graves' disease is the most common cause of hyperthyroidism in iodine-replete areas. Antithyroid drugs are the first-line treatment, but the recurrence rate is up to 50% after a standard course. Alternatives are radioactive iodine and total thyroidectomy, which carry adverse effects including risk of lifelong hypothyroidism. Prediction of non-remission after drug withdrawal would benefit decision-making. Known risk factors of recurrence include younger age, smoking, larger goiter, Graves' orbitopathy, GO, higher thyroid hormone levels, and higher TSH receptor antibody. Since individual risk factors have low predictive values, prediction models like the Graves score and the clinical severity score were proposed. However, no prediction model is available in the Chinese population. Our objective is to identify baseline predictors of non-remission in our cohort of Hong Kong Chinese patients. Patients with newly diagnosed Graves' disease were retrospectively analyzed. Remission was defined as maintaining euthyroidism at 12 months after drug withdrawal. Non-remission was defined as recurrence of hyperthyroidism within the period, or persistent hyperthyroidism despite at least 12 months of drug treatment. 159 patients were analyzed. 45% had non-remission. The presence of GO, raised TSH receptor antibody, and lower anti-TPO were independently associated with non-remission. However, underreporting of GO was suspected. An analysis was performed excluding it, showing that TSH receptor antibody and anti-TPO were independently associated with non-remission in the final model, which also included age at diagnosis. With these, a composite risk score called the Graves' Non-Remission Prediction Score, GPS, was constructed. The maximum score was 40. The area under the curve of GPS was 0.77, which was significantly better than any individual risk factors. Patients were then stratified according to their score as having low, moderate, and high risk of non-remission, with respective non-remission rates of 15%, 45%, and 75%. Drug withdrawal after a standard course is reasonable for low-risk patients. For moderate-risk patients, consideration of other risk factors like GO and goiter size is recommended. As for high-risk patients, prolonged drug treatment or definitive therapies should be offered. In this study, we demonstrated a remission rate of 55%, which was within the previously reported range. We included patients with persistent hyperthyroidism despite antithyroid drug as having non-remission. This is clinically relevant as drug withdrawal would be inappropriate in this group. In line with the literature, we showed that younger age and higher TSH receptor antibody were associated with non-remission. The predictive value of anti-TPO is more controversial in the literature. We are the first group to demonstrate anti-TPO, together with TSH receptor antibody, as an independent predictor in a composite risk score. Anti-TPO is associated with thyroidal lymphocytic infiltration and development of hypothyroidism in Hashimoto's thyroiditis. Similar destructive thyroiditis may explain its protective effect. Existing risk scores include the Graves score and the clinical severity score, which, apart from age, 3T4 and TSH receptor antibody, also included goiter size, GO, and genetic polymorphism. In practice, assessment of eye disease and goiter size subject to inter-observer variation, and genetic tests are not readily available. We believe that GPS, by utilizing simple, objective, and readily available data, could be applied in all levels of medical care. To conclude, in the fish tank of pretreatment risk predictors, no single fish seemed to have sufficient prediction power. Combination of parameters, or groups of fish, are used to serve the purpose. In our cohort, we have found our group of fish which answers the question. We proposed the first composite risk score, GPS, which comprised three simple and objective pretreatment parameters: age, TSH receptor antibody, and anti-TPO, to predict non-remission of Graves' disease in Hong Kong Chinese. The score has good performance. Further validation would be needed to confirm its role in Graves' disease management. Thank you.